What is alemtuzumab? And what is alemtuzumab injection used for? Alemtuzumab injection is used to treat adults with various forms of multiple sclerosis, MS, a disease in which the nerves do not function properly and people may experience weakness, numbness, loss of muscle coordination, and problems with vision, speech, and bladder control, who have not improved with at least 2 or more MS medications including relapsing-remitting forms, course of disease where symptoms flare up from time to time, or secondary progressive forms, course of disease where relapses occur more often. Alemtuzumab is in a class of medications called monoclonal antibodies. It works by decreasing the action of immune cells that may cause nerve damage. Alemtuzumab is also available as an injection, Campath, that is used to treat chronic lymphocytic leukemia, a slowly developing cancer in which too many of a certain type of white blood cell accumulates in the body. This video only gives information about alemtuzumab injection, Lemtrada, for multiple sclerosis. How to use alemtuzumab injection? Alemtuzumab injection comes as a solution, liquid, to be injected intravenously, into a vein, over 4 hours by a doctor or nurse in a hospital or medical office. It is usually given once daily for 5 days for the first treatment cycle. A second treatment cycle is usually given once daily for 3 days, 12 months after the first treatment cycle. Your doctor may prescribe an additional treatment cycle for 3 days at least 12 months after the previous treatment. Alemtuzumab injection helps to control multiple sclerosis, but does not cure it. When to use alemtuzumab injection? Before receiving alemtuzumab injection, tell your doctor and pharmacist if you are allergic to alemtuzumab, any other medications, or any of the ingredients in alemtuzumab injection. Tell your doctor and pharmacist what other prescription and non-prescription medications, vitamins, nutritional supplements, you are taking or plan to take. Be sure to mention the following: Alemtuzumab, Campath, brand name of the product used to treat leukemia, cancer medications, or immunosuppressive medications such as cyclosporin, Gingraf, Neoral, Sandimmune, mycophenolate, Celicept, prednisone, Tacrolimus, Astigraf, Invarsis, Prograf. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor if you have an infection or human immunodeficiency virus, HIV. Your doctor will probably tell you not to receive alemtuzumab injection. Tell your doctor if you have or have ever had tuberculosis, TB, a serious infection that affects the lungs and sometimes other parts of the body, herpes zoster, shingles, a rash that can occur in people who have had chickenpox in the past, genital herpes, a herpes virus infection that causes sores to form around the genitals and rectum from time to time, varicella, chickenpox, liver disease including hepatitis B or hepatitis C, or thyroid, heart, lung, or gallbladder disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you are female, you will need to take a pregnancy test before you start treatment and use birth control during your treatment and for 4 months after your final dose. Talk to your doctor about types of birth control that you can use to prevent pregnancy during this time. If you become pregnant while you are receiving alemtuzumab injection, call your doctor immediately. Alemtuzumab may harm the fetus. Check with your doctor to see if you need to receive any vaccinations before receiving alemtuzumab. Tell your doctor if you have received a vaccine within the past 6 weeks. Do not have any vaccinations without talking to your doctor during your treatment. What special dietary instructions should I follow? Avoid the following foods that may cause infection at least 1 month before you start receiving alemtuzumab and during your treatment: deli meat, dairy products made with unpasteurized milk, soft cheeses, or undercooked meat, seafood, or poultry. What side effects can this medication cause? Alemtuzumab injection may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Difficulty sleeping or falling asleep. Pain in legs, arms, toes, and hands. Back, joint, or neck pain. Tingling, pricking, chilling, burning, or numb sensation on the skin. Red, itchy, or scaly skin. Heartburn. Swelling of nose and throat. Some side effects can be serious. If you experience any of these symptoms, call your doctor immediately or get emergency medical treatment. Shortness of breath, chest pain or tightness, cough, coughing up blood, or wheezing. Fever, chills, diarrhea, nausea, vomiting, headache, joint or muscle pain, neck stiffness, difficulty walking, or mental status changes. Bruising or bleeding easily, blood in urine or stool, nose bleeding, bloody vomit, or painful and/or swollen joints. Excessive sweating, eye swelling, weight loss, nervousness, or fast heartbeat. Unexplained weight gain, tiredness, feeling cold, or constipation. Depression. Thinking about harming or killing oneself or planning or trying to do so. Genital sores, sensation of pins and needles, or rash on penis or in vaginal area, cold sores or fever blisters on or around the mouth. Painful rash on one side of face or body, with blisters, pain, itching, or tingling in rash area. In women, vaginal odor, white or yellowish vaginal discharge, may be lumpy or look like cottage cheese, or vaginal itching. White lesions on tongue or inner cheeks. Stomach pain or tenderness, fever, nausea, or vomiting. Nausea, vomiting, stomach pain, extreme tiredness, loss of appetite, yellow eyes or skin, extreme tiredness, dark urine, or bleeding or bruising more easily than normal. Weakness on one side of the body that worsens over time, clumsiness of the arms or legs, changes in your thinking, memory, walking, balance, speech, eyesight, or strength that lasts several days, headaches, seizures, confusion, or personality changes. Fever, swollen glands, rash, seizures, changes in thinking or alertness, or new or worsening unsteadiness or difficulty walking. Alemtuzumab injection may cause other side effects. Call your doctor if you have any unusual problems while receiving this medication.